We will presenting a budget planning under the Ministry of Health, following with the allocation provided for each of the program. As the representative of the Ministry of Health, every ringgit requested is not merely an expenses, but a vital investment in the lives of our citizens. However, without adequate financial support, it becomes difficult to implement new initiatives or sustain the public trust in our healthcare system. The success of the program that we implemented largely depends on the approval by the government. Notwithstanding that, the Ministry of Health has prioritized essential program components to ensure a successful implementation.
Today, I will be presenting the program of Peka B40 that was commonly known as Healthcare Scheme, following with the budget allocation that was introduced and fully implemented by the Ministry of Health. Thus, this also includes with the issue and the program improvement. The program is designed to provide comprehensive assistance to the B40 demographic. This program focuses on the individual who are the recipients of the Sumbangan Tunai Rahmah and their spouses are at the age of 40 and above are qualified to benefit this healthcare scheme. A significant number of people who comes from low-income households often delay the medical treatment due to the financial constraints. Thus, the existing of this program can help the patient to receive appropriate medical care without having a financial pressure on them. In response of the benefit, there is occurs circumstances faced by community of B40 who are not familiar towards the benefit due to the lack of awareness that resulting low participation rate among patients. Therefore, the stigma that still linger with the B40 group which causes them to be reluctant to seek for health screening and the fear of underlying the possibility illness as well as the concern over the treatment cost. Therefore, B40 group often perceive this program is not convenient because some of this treatment like health screening was conducted at private clinic, but further follow-up treatment had to be carried out at a government hospital. This situation creates difficulty and increased dissatisfaction of patients. Moreover, to address this issue, several improvements should be implemented such as to organize awareness campaign regarding the benefit of the Peka B40 program. From this campaign, we can provide clear information regarding eligibility requirement, registration procedure and follow-up treatment process. Thus, in order to reduce inconvenience among patients, the follow-up treatment should be carried out at the same clinic so that it will be convenient for patients and reduce their time. Moving on to the budget allocation. Budget allocation is necessary to ensure the purpose of improvement can be implemented effectively. However, the following table represents the estimate budget that necessary to sustain the improvement of the program with the providing allocation of 1,109,636 ringgit. For Peka B40 program, there is allocation of 80 million ringgit Malaysia provided by the MOF. On the other hand, total allocation of 1,109,636 ringgit Malaysia refer to the improvement of the program. Overall, combined allocation comes to a total 81,109,636 ringgit Malaysia.
I will continue to the second program, which is the Emergency and Trauma Department. The Emergency and Trauma Department in a government hospital is the part of the hospital that handles urgent and life-threatening cases for 24 hours a day. It is usually the first place patients are brought when they arrive by ambulance or walk in with serious conditions such as accident, chest pain, breathing difficulties, severe infections, or heavy bleeding. As we know, The emergency department is the most crucial and challenging areas for nurses and doctors to manage patients in unpredictable condition. There is some issues that have been come out from my interviews with several individuals who have experience with the emergency department. The only issues that consistently emerged was long waiting times. This is associated with the impact of waiting duration, where condition may become worse, some cases become life-threatening, and the other complication may arise. One of the main suggestions for improvement from the current issues is to increase the number of nurses and doctors in the emergency department, as the current workload can become overwhelming, especially during a peak hours and emergency situations. By having more medical staff available, patients can receive faster medical attention and treatment, which can help to reduce long waiting times and prevent their health conditions from becoming worse while waiting for care. In order to make improvement from the current issue, there is budget allocation that I would like to present for this second program, which is hiring doctors, hiring nurses, construction, medical equipment, beds, chair, and the total budget allocation for this second program is 1.830.000 ringgit Malaysia. After adding the proposed improvement budget from 1.830.000 to the recent budget of 1.039.710.300, the total becomes 1.041.540.300. This increase is necessary to support the enhancement of emergency department services, including the recruitment of additional healthcare workers, expansion of treatment facilities, and provision of better medical equipment for patients.
Today, I will be presenting an issue faced by the transfusion medicine department and a program improvement that can help address the issue. The transfusion medicine department is responsible for managing blood donation activities, testing donated blood, storing blood supplies, and providing blood products for patients who need blood transfusions. The department supports many medical treatments, including surgeries, emergency cases, cancer treatment, and childbirth complication. One of the main issues faced by the department is the shortage of blood supply. The demand for blood continues to increase, while the number of blood donors is often insufficient to meet the growing need. In addition, blood products have a limited storage period, making it challenging for hospitals to maintain adequate blood stock at all times. As a result, patient treatment may be affected when blood supplies become low. To address this issue, I propose the implementation of MyDarah, a national sharing system that connects blood banks across government hospitals in Malaysia. Through this system, hospitals can monitor blood stock levels in real time and request blood from nearby hospitals whenever shortage occurs. This system helps reduce blood wastage by allowing hospitals with excess blood stock to transfer blood products before they expire. The proposed budget for MyDarah is 110,000 ringgit. This allocation will cover system development, cloud servers and databases, computers and equipment, staff training, system security, awareness material, and annual maintenance. With this additional allocation, the total budget will increase from 142,538,200 ringgit to 142,648,200 ringgit. In conclusion, the implementation of MyDarah can improve blood supply management, reduce blood shortage, and strengthen coordination among government hospitals. This will help ensure that patients receive the blood they need efficiently and on time.
I will make a simple summary for the budget allocation from Program 1, Program 2, and Program 3, which is the budget of program implementing by OBBS. The total OBBS is 3.049.636 ringgit Malaysia, and I already divided the total budget allocation into operational expenditure and development expenditure. And the total for operational expenditure is 1.269.200 ringgit Malaysia, and the development expenditure is 1.780.436 ringgit Malaysia. By having this improvement for the program 1, 2 and 3, there is several challenges that we have to faces during the improvement. And for the challenges, I will pass to the next presenter.
Moving on to the next challenges, which is time-consuming planning and approval process. One of the main challenges in long-term healthcare planning is lengthening approval process. Healthcare programs often require multiple consultations and approval before implementation, causing a significant delay. For instance, Malaysia Cervical Cancer Screening Program took nearly 10 years to receive policy approval. Such a delay may prevent the public from accessing important healthcare services when they are needed. Therefore, a more efficient planning and approval process is needed to ensure timely healthcare delivery. Moving on to the next presenter.
Now, I would like to discuss an issue commonly faced in healthcare sector, which is staff shortage. Human resources are very important in ensuring that hospitals can operate efficiently and provide quality care to patients. However, many public hospitals in Malaysia are currently facing shortage of healthcare workers while the number of patients continue to increase. Due to the shortage, existing staff often have to take on heavier workloads and work longer hours. This can lead to stress, fatigue and burnout. As a result, employee well-being may be affected and the quality of healthcare services may decline. For example, hospitals in Johor are facing a shortage of about 1,700 nurses. In some cases, a nurse may need to care for 10 to 14 patients in a single shift, which is higher than the recommended ratio and may affect patient safety. In short, staff shortage remains a serious challenge in the healthcare sector. Therefore, effective workplace planning, stronger recruitment efforts, and better staff retention strategy are needed to ensure hospitals can continue providing quality healthcare services.
Limited financial resources are one of the major challenges in ensuring the successful implementation and improvement of the program. Insufficient funding can restrict the execution of proposed initiative and activity, thus making it difficult to meet community needs effectively. As a result, greater emphasis must be placed on financial planning and the prioritization of essential program components. In addition, adequate funding is important to ensure the long-term sustainability of the program, as it supports the improvement healthcare services, the purchase of modern medical equipment, and also the development of new facilities. Therefore, the success and continuity of the program largely depend on sufficient financial allocation and government approval.
To sum up, effective program implementation is important to ensure that organizational goals and service objectives are achieved. By making proper planning, budget management, and continuous improvement, it can contribute to the success for each program. Despite challenges such as time-consuming processes, staff shortage, and limited financial resources, this issue can be addressed through effective management and strategic planning. Therefore, continuous efforts are necessary to ensure programs are implemented efficiently and deliver the intended benefit to the target groups.